So yeah, in part one we touched on prescription medications. Been on quite a few over the years. Opioids, antidepressants, nerve blockers, all sorts of crazy pills. Very very trapful medication, and most of them have sort of horrific side effects, nightmares, visions, all sorts of crazy side effects that I'd suffered from a lot of medications. One particular medication I can't remember the name of it now, but I had complete loss of feeling in all my extremities. Literally could not feel my arms and legs. So that was pretty wild. So I touched on opioids. Antidepressant drugs showing great promise in treating symptoms of neuropathic pain. Two common types of antidepressant drugs are prescribed sort of fairly at large is tricyclic, I think it's antidepressants, and serotonins. And then obviously implantable devices. I'd actually been approved through WorkCover to receive an electrical implant device to treat the chronic pain. Unfortunately, well, not unfortunately, I just chose not to go down that route of more evasive surgery because it's just not an option. And basically, a lot of my pain comes from the upper thoracic area throughout the shoulders, chest, and neck. Most devices for this are generally used for lower back pain, which most of them are trialled for. So I just wasn't going to take that risk of having an implant put in and for it to not work. So it's an invasive procedure. Surgeon implants a device into your body. Basically, they drill a line out of your skull, plant magnetic probes into your brain. The lead then runs down through your skin into your abdominal area. They put like a pacemaker style setup with electromagnetic impulse, and then you can control it by a remote. So you can literally adjust it to disrupt the nerve endings and the signals that go to and from your brain to your pain receptors and try and confuse them to stop sending those signals. It does work for some people, and it has worked for a lot of other symptoms like epilepsy, migraines, things like that. So it is an option. Again, not a medical professional, so can't advise to or not to get, but yeah, seek some proper medical advice when you're thinking about electronic device implants. Stick around for part 3.